Hello, and be very welcome to the channel. If you worry about your health or have someone dear living with diabetes, this video is for you. We all know that diabetes is a serious condition, but what many people don't realize is that some of the most dangerous signs of the disease happen just as you are sleeping. And as you are sleeping, you may not even notice, but your body realizes. So in today's video, I will show you the most dangerous nightly signs of the diabetes you need to know. These signs are alert that your body sends when glucose is out of control overnight, and ignoring them can endanger your health. So take paper and pen and stay with me until the end, because at the end of the video, I will also share powerful strategies for you to take control of your nights and wake up feeling safe, rested, and in charge of your diabetes. Oh, and before we start, you already subscribe to the channel and activate the bell so you don't miss any health and well-being tips. It is important to be aware of all the signs that diabetes can present at night. These symptoms are essential for those who deal with diabetes or know someone who has this condition. Follow this journey of knowledge about the dangers of diabetes at night. Night sweats. Night sweats may be a sign of night hypoglycemia in people with diabetes. These sweats go beyond the common to sweat during sleep. These are intense episodes that can make the clothes and sheets soaked, even in cold environments. It is as if the body is sending a neon alert to something called hypoglycemia nightly, which basically means low blood sugar at night. Several factors can trigger these night sweats, from certain drugs and high doses of insulin to the diet adopted throughout the day or an intense session of exercise at night. But why is this relevant? In addition to disrupting repairing sleep, night sweats indicate a dangerous drop in glucose levels. To face these night floods, it is crucial to act as a detective of blood sugar levels, to constantly monitor, identify possible causes, and discuss with the health professional about adjustments in medication. And remember the fundamental tip: keep fast sources of glucose, such as tablets or glycated juice, to deal promptly with abrupt falls in the sugar at dawn. Restless leg syndrome. Restless leg syndrome causes your legs to act on their own, generating an incessant feeling of moving or moving the lower limbs. For someone with diabetes, this syndrome may be associated with peripheral neuropathy, a problem that arises due to prolonged and high blood glucose levels. The relationship between RLs and diabetes is complex. Sleep becomes a challenging task when the legs seem to have a life of their own at night. How to deal with it? First, keeping glucose levels under control is essential to prevent or relieve neuropathy. Reducing caffeine and alcohol consumption can minimize RLS symptoms. In addition, light exercises before bed can help calm their restless legs. Also, consider massage to the legs or apply hot or cold compresses to relax the muscles. Finding methods that calm your legs during these episodes is critical to ensuring a quiet and restorative night. Night hypoglycemia. This phenomenon can manifest in a sneaky way, presenting symptoms such as intense night sweats, agitated dreams, and even waking up with headaches. For individuals with diabetes, at night, hypoglycemia can be a silent problem that brings severe complications, including risks of seizures or fainting. The key to dealing with this situation is to closely monitor glucose levels, especially before bed. If they are low, it is recommended to make a light snack containing carbohydrates to avoid sudden falls at dawn. It is essential to act as a diabetes detective, communicating any changes in symptoms to the doctor for possible adjustments in the medication. Always have quick sources of glucose, such as gels or pills, to face these sudden casualties in sugar at night. Also, do not forget the importance of educating friends and family about the signs of severe hypoglycemia and how to act in emergency situations. With teamwork and dedication, it is possible to guarantee a quieter and safer night for those who live with diabetes. Sleep apnea. Sleep apnea is like a hiccup in your rest, where breathing takes small breaks or becomes superficial while you are sleeping. For people with diabetes, this condition can be especially challenging, as it disturbs repairing sleep and impacts oxygen levels at night. In addition, there is a significant connection between overweight and the development of both sleep apnea and type 2 diabetes. The action plan here is simple but crucial. Even losing a little weight, you can get significant benefits in reducing the symptoms of sleep apnea. For immediate relief, there is an intelligent device called CPAP that keeps the airways open during sleep. Some changes in lifestyle can also make a difference. Avoid alcohol and sleeping compresses as they relax the muscles of the airways. Try sleeping on your back instead of your back to keep the airways cleared. Remember, sleep apnea and diabetes are not good friends, but managing one can help in control of the other, bringing benefits to both blood sugar levels and a quiet and invigorating night. Thirst. The feeling of insatiable thirst at night can indicate an imbalance in blood glucose levels, which attracts cell water to try to dilute excess circulating sugar. This constant demand for liquids leads to multiple trips to the bathroom at night, interfering with sleep and quality of life. To deal with this excessive night thirst, it is essential to maintain strict control of blood glucose throughout the day, avoiding peaks and sudden falls. In addition, it is recommended to distribute fluid intake throughout the day and reduce caffeine and alcohol consumption before bed. Night thirst can be a preliminary and valuable signal for adjustments in medication or diet. By understanding and responding properly to this symptom, it is possible to contribute significantly to the effective management of diabetes. Night cramps that can affect individuals with diabetes. These sudden and painful muscle spasms can be triggered by several factors, such as imbalances in blood sugar levels, blood circulation problems, or even nutritional deficiencies. For those dealing with diabetes, these cramps can become an unwanted visitor at night. In addition to immediate physical discomfort, night cramps can interfere with sleep and quality of life. The way to relieve these involuntary spasms involves keeping glucose levels under control, ensuring adequate hydration and balanced nutrition, as well as smooth stretching before bed. Taking care of muscle health and maintaining a balanced routine are essential measures to minimize the impact of night cramps and promote a more peaceful and invigorating rest. Excessive headquarters. Excessive thirst at night is a revealing sign for individuals with diabetes. This constant feeling of having to urinate at dawn may be a crucial indicative of imbalances in blood glucose levels. As the body tries to eliminate excess sugar through urine, there is an internal dehydration, leading to incessant search for liquids. In addition to interrupting sleep and causing discomfort, exacerbated night thirst can directly impact the patient's quality of life. To deal with this symptom, it is essential to maintain a strict supervision of glucose levels throughout the day and establish a balanced routine of water intake. Reducing caffeine and alcohol consumption before bed can also contribute to alleviate excessive thirst at night. Recognizing and responding properly to this early signal are crucial steps to ensure effective diabetes management and promote more quiet and restored nights. It is very important to maintain a healthy routine and follow the appropriate medical guidelines to avoid nightly diabetes complications. In addition to regularly monitoring glucose levels and adopting a balanced diet, it is crucial to practice adequate physical activities, such as hiking or supervised exercises, to help control diabetes. In addition, it is essential to prioritize quality sleep, ensuring a conducive environment for rest, avoiding distractions, and keeping regular sleep times. Make routine adjustments according to medical guidelines, and seek professional support when necessary are essential steps to keep diabetes under control overnight. It is extremely important to maintain continuous monitoring of glucose levels at night for people with diabetes. It is essential to be aware of the possible warning signs that the body can present while we sleep, such as excessive sweating, frequent thirst, muscle cramps, and frequently to the bathroom. Also, it is essential to understand that diabetes does not take a vacation and may require adjustments in medication or diet even at dawn. By recognizing and admitting promptly in the face of these nightly symptoms, we can guarantee more effective control of the condition and promote a better quality of life. Do not hesitate to seek professional guidance to develop personalized strategies to deal with diabetes at night. Recognizing these early signs of warning at night can play a significant role in proper condition management. In addition, being aware of available resources such as glucose monitoring applications or online support groups can help monitoring health and exchange experiences with other patients. Maintaining open communication with the medical staff and following diet, medication, and physical activity guidelines are key steps to ensure effective diabetes control during the night. Remember that you are not alone on this journey. Seek professional help whenever necessary and be aware of the needs of your body. Self-care is a powerful tool to face the challenges imposed by diabetes at night and ensure a better quality of life. Prioritize your health and well-being, remembering that knowledge and constant care are essential allies in the management of this chronic condition. Subscribe to the channel for more useful health and fitness tips. Thanks for following the video. If you have found this useful information, be sure to subscribe to the channel and activate notifications. Until the next video.